Hello, come closer. This message may help you or help someone close to you. Healthcare is a very wide organization that have different professionals. There are different professionals, and the main goal is for patient care, is for optimum healthcare for individuals, family, and community. So I'm streamlining, I'm trying to narrow down what I'm going to say to the pregnant woman. If you know you are pregnant or you have someone close to you, you should be able to know there are some people, not because they cannot take care of you, but because of their level of the knowledge they have or the skill that they have at that particular time, they cannot be able to manage you properly and adequately. I'm coming somewhere and I'm also going somewhere. So stick, let's listen to the end of what I'm saying. You see, let me just narrow it down to these two professions. The nurses, these three professions, the nurses, midwives, and also the medical doctor. And in the medical doctor, we have the obstetrician. You are a general nurse, you left school, maybe School of Nursing, or to finish your university, your post NYC, you are now rendering your service as a nurse. You have some skills. When you see a pregnant woman, you know basic. Now, maybe that same nurse now further her education or his education to midwifery course. You really want to know the details a lot concerning a normal pregnant delivery and post delivery care, and also have the ability to identify complication and refer appropriately. So this is a midwife. Now, so the doctor that have finished his or her NYC, maybe now working in any hospital as a general practitioner. He or she is also expected to know basic, but as far as pregnancy, delivery is concerned, a midwife is more expertise in that regard. So when you have a private hospital that is being owned by a general practitioner that does not have a specialty, as in a midwife, and that particular hospital have pregnant women, you should ask questions, because some complications are easily identified by the midwife, and because she knows her limitations, she'll be able to refer as quickly as possible and as prompt as possible. Now that's a medical doctor now further his or her education, maybe a residency program to obstetrician, to be an obstetrician. That particular doctor have more expertise, has more skill in pregnancy, delivery, and what have you. So where I am going now is that a pregnant woman, you have issue, you have lost a child before, or you are above 35 years, or you have medical condition, or you have genetic issue, you have problem that is coupled with the pregnancy, you are no longer a midwife case. Or are you also a case for a general practitioner? You need to be in a place where there are specialized professionals, that's in obstetrician, that are able to manage complications in pregnancy, in child delivery, and also postpartum. So you are no longer a case of anyhow private hospital. You're no longer a case of a primary health center. You are a case that needs specialized care. Or you have a very long or prolonged labor before, maybe one thing or the other, the child came out abnormal, because you see, when they have a child have a prolonged labor, and there is no alternative delivery like CS, cesarean section, the brain of the child tends to die faster. And a midwife may not have their particular services in that center. Primary health center may not have it. So it is better you start your antenatal clinic where they have it, because you already have an issue. Maybe they already diagnosed that you have inadequate pelvis. Yeah, I didn't say you should not believe in God. Believe in God. But as you are believing in God, still also do your own. God is not against any medical professional. God is not against any medical practice. Miracle can happen even on the couch, even on the theater table. The baby will come out before the first incision. So I'm not saying you should not believe in God. They've already diagnosed that you are not capable to deliver that baby. You are going from one prayer house to another prayer house that have another room they can deliver women. Know this and know peace. You are no longer a candidate of primary health center, because they'll first of all refer to general hospital. If there's no space that day, it's a pitiable condition. The same private hospital also refer to the general hospital. So why don't you start from where you are likely to be referred? You have an issue with other pregnancy, you have a heart problem, serious issue that you know that your last baby that you almost lost that child. Don't start with a midwife. Though there are few cases, these few cases are for specialized people. You start from general hospital or you go to the teaching hospital. But you always have a normal pregnancy experience, no issue, everything goes fine, which mostly like 60 to 70% of women are expected to go through that. Everything should be fine, normal, just normal, minor signs or minor discomfort in pregnancy is what you're experiencing. If you are a midwife candidate and you are also a candidate for primary health center, no need of you going up there to just overstress the facility when you don't need much resources. So just think about it and think through. Don't risk your life because you want a kind of to go to a place that they will attend to you fast. They will call you all sorts of sweet names, all sorts of that. We're talking about skill here. We're talking about expertise here. We're talking about people that know what they're supposed to do. And again, there are some people that know what they're supposed to do, but they don't have the facility. Like in a place where your baby is already entrapped, it cannot come out, and there's no way. They have to push you to the to the general hospital to know if the baby can come out through cesarean section. But if you're in a place already, they have that facility. Even if there's any problem, the next room is the theater. You'll be saved. Your baby will also be saved. A lot of people have been referred for one serious cases or the other at the dying minute. So listen to yourself and listen to this and be able to advise yourself and know what to do. All this medical condition and all this problem I listed earlier, if you have. So I believe that this will help someone there. Please continue to like, to share, and follow this for a topic related to this. I'll keep posting this. Thank you.